So for someone who's struggling with certain, well, if your expertise is more in sex addicts, is there something that you would tell someone who's struggling and who doesn't think they're enough, and who you would want to assist if someone is listening to this?
Yeah, if you're struggling with sex addiction, I mean, there's a lot of different things that qualify that. It doesn't necessarily mean that just because you feel you're a sex addict doesn't necessarily mean that you're diagnosable sort of as a sex addict. So there's some different things that, and again, probably don't have time right now to kind of get into that, but there's certainly some aspects of that they're true. But one of the things, I guess I'd say, is that if you are struggling, the first thing I can suggest is certainly reaching out to finding somebody who is a certified sex addiction therapist. So they're called the CSAT. And CSATs are kind of I definitely know there's throughout the United States and Canada, there's definitely multiple people who have that specialty. So basically it's kind of like, if you go to the doctor and the doctor specializes in, your knee. So if like you have a knee injury, you're going to go to a specialist that works only with the knees. It's the same kind of thing. CSATs only really work specifically with sex addiction. And they have a background of basically Dr. Patrick Carnes, who was kind of the leading guy who started a lot of the sex addiction research back in like the 70s and 80s. Dr. Carnes' program is really world renowned, and a lot of people use it. So it's kind of a kind of the sort of standard for sex addiction therapy and treatment. And a lot of folks who are CSATs usually will use his recovery program. So definitely something worth looking into that if you're struggling with those types of behaviors. I think the other thing is also making sure that you're putting yourself in a position where you can succeed.